world.
The City of Seattle is looking for a collaborative, innovative leader with experience in growing creative industries and developing equitable opportunities for the economy of the future. The Inclusive Creative Industry Director will help lead the city's recovery efforts that address the needs of Seattle's creative industry sectors, such as music, film, performing arts, nightlife, special events, emerging technologies, and more. We are looking for someone with a background in economic development, experience in the creative industries, and ability to collaboratively center the work in racial equity and social justice. Applications are due by February 23rd. For more information on the position and how to apply, email the Seattle Office of Economic Development at oed@seattle.gov.
Hello, listener. What's important to you about what's going on in your community? Are you interested? Are you concerned? In any case, I invite you to tune into my show, Seattle Here and Now, on Rainier Avenue Radio App. Why? I will be covering a wide range of topics important to you and impacting the community. Each show will have a special guest or guests to share with you information on a variety of subjects that are happening here and now in Seattle. I promise I will work hard to make my show informative, interesting, and entertaining. Be sure to listen to Seattle Here and Now on Rainier Avenue Radio .world.
This is the news on Rainier Avenue Radio. A new study ranks Seattle as the second healthiest city in the nation. The study by personal finance website Wallet Hub compared more than 180 of the largest U.S. cities across 44 key metrics, from the cost of medical visits to fruit and vegetable consumption to fitness clubs per capita. Seattle came in second in the nation for green space as measured by parkland acreage per capita, hiking trails per capita, and number of bike riders and walkers. San Francisco ranked as the nation's healthiest city, with Seattle as a close second. Portland, Oregon was ranked as third healthiest. Seattle posted some impressive scores in individual areas as well, ranking first in the nation for its share of physically active adults and fourth for most running and walking trails per capita. The nation's least healthy city, according to the study, is Brownsville, Texas. Other cities ranking in the bottom 5 are Laredo, Texas, Gulfport, Mississippi, Shreveport, Louisiana, and Memphis, Tennessee. And that's your news on Rainier Avenue Radio.
You're listening to Rainier Avenue Radio .world.
Welcome. This is Brenda Charles-Edwards, the host of Seniors Matter. We are live every Friday at 12:30 Pacific Standard Time on www.rainieravenueradio.world, your community radio station. You can also listen to us on the Rainier Avenue Radio app and Alexa. You can watch us on YouTube, Twitch TV, and facebook.com/rainieravenueradio.world/videos. Seniors Matters invites a variety of guests to discuss issues and activities that may impact the lives of older adults and their families. If you have any questions, please put them in the comment section on Facebook, or you can call 206-290-9685. This is Black History Month. Tonight at 7 p.m., the Friday Family Night film will be Change in the Family, a Sam Hampton film. My guest today is Darryl Means, the Northwest Regional Administrator at the Centers for Medicare and Medicaid Services, known as CMS. He will discuss everything we need to know about CMS, the COVID-19 vaccine, and the Marketplace Special Enrollment Period that runs from February 15th to May 15th, 2021. Welcome to the show, Darryl. Can you hear me, Darryl? Darryl, can you hear me? Unmute your mic. Unmute your mic. Okay, Darryl, welcome to the show. How are you? Well, Darryl, I'm not hearing you. So can you turn up your mic, maybe? Okay, seems like we're having, Darryl is here now, so let's hear from Darryl. Okay, So, Darryl, let me give a little more information about you while we get things adjusted. You joined the Centers for Medicare and Medicaid Services in 2009, and you're the executive leader responsible for overseeing Medicare and Medicaid programs, agency initiatives, business and partnership development, and outreach and education throughout the region.
How about now, Brenda? Can you hear me?
I hear you now, Darryl. Yay!
I don't know what goes on, but sometimes when I go from meeting to meeting, things kind of screw up. So I apologize to you and your followers about that.
Not a problem. We're living in that age. It's no problem. So did you hear my intro about you?
I did, and it's so formal and so nice, but it is nice to be here with you and to share with your followers what we're about to talk about.
Yes.
I think it's very important. I'm happy to be here.
Thank you so much. So let's get into it. Can you tell me, or should I say, can you tell us a little bit about CMS and your role with the agency? I did give them a little background, but I know you can expound on that.
Oh, that's fine. I think you did a good job. And Medicare and Medicaid was established in 1965. And today, I'm proud to say it provides health insurance to more than 100 million people worldwide. And 1.4 million people are on Medicare alone in the state of Washington. So I think that speaks to the program itself. At CMS, we oversee the Medicare, Medicaid, Children's Health Insurance Program, and also the Marketplace, which some call Obamacare, but it was a product of the Affordable Care Act. And as the regional administrator, I exercised the oversight over these programs in Idaho, Washington, Oregon, and Alaska. And I'm also responsible for the operations, the day-to-day operations of the Seattle office, partnership development, customer satisfaction, and things like that.
Wow, that's a lot. That's a big role. So right now, there's so many things that are important about Medicare, but our biggest thing right now is the COVID-19 vaccine, which I know that Medicare is involved with that too. Can you tell us a little bit about that?
You're right. That is the biggest thing, I think, in the healthcare world right now. Not that everything else has stopped, but we are trying to get a handle on this and put this to bed, if you will. Today, CMS is laser focused on this unprecedented national emergency that we're talking about here. And we want to ensure that all communities have access to the vaccine that they need to stay healthy. So I trust your followers know that the vaccine began rollout here recently across the country, and CMS has taken actions to protect the health and safety of our nation's patients and keeping them updated on the latest information, not only from CMS, but from HHS, Health and Human Services, and the CDC, Centers for Disease Control. We encourage everyone to get the vaccine when it's made available to them. And people should understand that the vaccine is safe, regardless of what people are hearing. And their safety is a top priority of the COVID-19 vaccine. So medical experts have proven the effectiveness of the vaccine in preventing people from getting the disease. And despite what people may think, you cannot get COVID from the vaccine.
Right, I've been hearing that. I had just, just finished working a vaccination for the last 2 weeks, and we vaccinated over 800 people. And I tell you, that was a project. It's not over because that was just for the first shot, and next month we go into the second shot. But it was really great to see that we were able to vaccinate that many adults over 65. So it was a blessing.
And Brenda, I want to add here, I just need to add that I am so proud of what you and the churches are doing to bring this vaccine to the community. I know it's a heavy lift for you with everything, but I respect that and I appreciate all of that.
Oh, you know, I just was grateful that I had the opportunity and that it was available. So I think that to me was the number one thing. So, but with that said, Darryl, how are we going to combat the vaccine hesitancy, especially among our people as African Americans?
Well, I'm glad you used the term "we." Because it's not just the federal government, and as we say in the African American community, it takes a village. As an American myself, I believe it is important to acknowledge first that hesitancy that may exist in the community is rooted historically in the treatment of African Americans throughout U.S. history. I don't think we can go on without saying that. Therefore, there may be some justification as to why people feel they need to be hesitant because of what's taken place over the years. But according to data from the CDC, I think what's important is that people need to remember that African Americans make up 16% of those who die from COVID. And we're only 13% of the nation's population. So that's 2 people, Black people, dying from COVID-19. That says we, and I'll go back to the we, all African Americans still remain hesitant and to trust the science and the efficacy of the drug and the federal government. Therefore, at CMS, we are, along with our entire federal community, working as hard as we can to ensure people know the facts and are able to make informed decisions. CMS is working hard, Brenda. I can't tell you how hard we're working to rebuild the trust in the Black community. And that's why I'm truly happy to be here today to share that facts. In my mind, facts matter too.
Well, and I have to admit, Darryl, I was hesitant about getting the vaccine, but when my, and I can't tell her age because she'll beat me to death. I don't know, but she won't be happy with me. But let me just say 90 plus mother. And then my brother and my husband said they were all going to take the vaccine. And I'm like, I don't know. But then I am also, according to the governor, an essential worker because I'm a notary, public and mobile. I go to everywhere. I was just at a nursing facility the other day. But what they're doing now, they have the patient come down to the lobby to sign. You don't go up to their room or anything. But I had my shield on, my 2 masks, and my gloves. So I was ready. So I knew that I needed to protect myself as well as my family. So I got over it,
I appreciate that. And to be honest with you, I have 2 parents right now in the nursing home together back in Philadelphia. So this means the world to me that people, especially caregivers, get the vaccine and don't expose my parents. My mother was like what you were just saying. She's hesitant about it as well, but she has moved along and now she is getting the vaccine. She's already received her first one and she's looking forward to her second one.
Now, I did notice something Darryl, when I was working with people being registered the day of the vaccination, that, well, actually, it was the City of Seattle Fire Department, they were asking people about their health insurance. And so I overheard this one conversation and I said, well, why are you asking them about their health insurance? Because I knew this was free. And he was saying something about the different health insurance agencies wanted to know who was getting their shots. Do you know anything about that?
I don't know directly what you're talking about, but obviously, folks, they want to make sure that if people are getting the first shot, that they're in line for the second shot in time. And that may be what you're hearing. Again, I wasn't privy to that conversation, but it would be my thoughts that they're trying to ensure that they track people for the second shot.
Okay. If you're just tuning in, you're listening live to Seniors Matter with your host, Brenda Charles-Edwards. Seniors Matter is a community partner with the Rainier Avenue Radio.world, and we're on every Friday at 12:30. You can also get us on the Rainier Avenue Radio app, Alexa, and you can view us on YouTube, Twitch, Facebook.com/Rainier Avenue Radio.world/videos. Do you need financial documents notarized? Are you a senior that need documents read to you for clarity or completion? Call me, Brenda at Black Orchid Notary, 206-683-2636. Tell me where, I'll meet you there. Now back to my guest, Darryl Means. And Darryl, so as we said, Centers for Medicare, oh God, I lost it. CMS stands for?
The Centers for Medicare and Medicaid Services.
Right, thank you. So what are they doing to increase access to coverage during the pandemic?
Well, there's a couple of things that we're doing. One, we want to make sure that people stay protected and that they understand that the vaccines are out there and where to get the vaccine. So we do tell people to make sure that they stay in contact with the states, because the states are responsible for this rollout, and they need to be in contact with the state to see when they are getting the vaccine and be prepared for that. But with respect to us, we've increased coverage during this pandemic. One of the things that we've noticed is that it's presented unprecedented challenges to the American public. Millions of Americans are facing uncertainty, new health problems during the pandemic, and many remain uninsured or underinsured and still need affordable care. So one of the things that we're doing because of this, CMS is providing a special enrollment period. We call it an SEP for individuals and families who can apply and enroll in coverage they need through the health insurance marketplace at healthcare.gov. So this SEP will be available to consumers in 36 states, and these states are served by Marketplace that uses healthcare.gov platform. And there are some states that don't use that. They do it on their own, such as Washington, and we're encouraging those states as well to afford everyone the opportunity to get into healthcare, because people need healthcare during these times. So this is another avenue that we're using for that. And for people in Washington, if they're interested in an SEP, then I urge them to contact their Washington Health Care Finder at WA Healthcare Finder, that's all one word, at .org.
So the enrollment period started on Monday, the 15th, and it goes through May 15, right?
That's correct. And people can apply for coverage through healthcare.gov website. The nice thing is, if you get on healthcare.gov as well, it'll route you to the right state. And if your state is not one of the ones covered under the federal marketplace and you have your own marketplace, then if you click on your state, it'll send you directly to your state's marketplace so that you can apply there. But people should check right now. They have until May 15th, as you say. And they should check to see if they're eligible for coverage or financial assistance. They can go online themselves directly, and they can check for them and their families to see if they qualify. If not, if they need additional assistance, there's plenty of places they can go. They can go to 1-800-318-2596, which is the Marketplace call center, and that's available 24 hours a day, 7 days a week. Or they can reach out to the 50,000 registered agents, brokers, assisters, people, throughout the country, but we have them here as well in the Washington area. And you can find those on healthcare.gov as well. If you go on there and you look down the bottom, you'll see a little tag that says Find Local Help, and you click that button, put in your information, it'll tell you who's available to assist you in your area.
Great, thank you. So now, and it's being shown right now on our screen. Now here's an area that I'd like to talk to you about. I work with AARP in their fraud division, as well as giving presentations about Medicare and just healthy living. But, there's a lot of COVID scams going on right now, as well as poor Medicare has been getting scammed on for years. And unfortunately, our seniors, with this pandemic going on, they feel isolated. And so when the phone rings, they're going to answer the phone, because now's an opportunity to hear another voice other than the TV. And they may sometimes get caught up in these scams. What are you hearing about these COVID-19 scams as far as Medicare is concerned?
Well, scams, Brenda, are not endemic or direct to the healthcare environment alone. I mean, during any type of national emergency, we see the scammers come out and they're there every day. And people should realize that scammers are out there trying to get their Medicare information as well. And we tell folks to guard your card. These are things that we tell them to do. And we suggest that they do that here. One of the ways they can prevent being a person who is scammed is that they should go through official channels, i.e., if they have their doctor, they should work with their doctor to see if he or she has the vaccine, or where they can go and get a recommendation from their doctor. Or, as I said, they can get on with the state. They can register with the state. The state will contact you and tell you when and where to go for your vaccine shot. So it's important that they stay vigilant. And if someone calls you up and say, "Hey, I can get you in early," or we know that that's not happening. We could just see that on TV, that people are waiting, people are in line. So it's important that people be vigilant and guard their card. They may be asked for their information just to validate that they're on Medicare, so that the individual who is given the vaccine can bill Medicare for the administrative portion of that vaccination. But they should not be paying anything. So if people are calling and asking you to bring your card because they want to get you in earlier, or they have a cheaper way for you to get the vaccine, I would encourage your followers to call Medicare and see if that is true, or to call the state to see if that's a true partner with the state or clinic with the state that's giving out the vaccine.
And I'd just like to add a couple more things to that too, is that Medicare will never call you to sell you anything. And it will never visit you at home. And Medicare can't enroll you over the phone unless you call first. So these are things that, we need to know and just keep in mind, because like I said, with COVID, it's been isolating a lot of people. And when that phone rings, they just want to answer it. My mother told me she gets calls. I don't even know how many calls a day with somebody trying to sell her something from trying to for charity, or just anything. And it's just crazy. And I have her on that do not call list, but that doesn't seem to be working very well. So I just tell her, I said, when they start out and it doesn't sound right, hang up. I said, you have that right. Don't be afraid to. Don't feel like you have to be polite, because you don't. It's your phone and they're invading your privacy. So I just wanted to throw that in there. So is there anything else?
I appreciate that, Brenda. I have to say you've done your homework, and I'm proud of you, because that's what we want our seniors to do. They need to get the facts. They need to check on our website at CMS, and if they are interested in healthcare options, healthcare.gov. All of these are ways that they can do it. And these are things that we say throughout the year to seniors with our Guard Your Card, that, be careful. We're not going to call you, and just let people know how things are. So thanks for bringing that up as well.
Oh, you're welcome. Like I said, I wear a multiple of hats, and one of them is the fraud. And I write articles for my church called Seniors Matter. And by the way, for those that don't know, Seniors Matter is with an exclamation mark, just like Black Lives Matter, Seniors Matter. So that's why this show came about. So Darryl, is there anything else you would like to add that we haven't covered?
I think we covered most of it, Brenda. And I know when you started this, you said that we're going to say everything that people are going to learn everything that they can about CMS. And that's impossible to do in a short podcast. But what we want people to know is that, one, that the Marketplace began on February 15th and runs through May 15th, as we stated. And it's another opportunity to get health insurance at an affordable price. So people should go there and check it out. If there are people with financial challenges, they may even qualify for Medicaid. And in some cases, we've seen that a lot of people who qualify for Medicaid can get health care at $0 cost, so with no premium. Also, we should say that new enrollees should check out, and people who are current enrollees, they should go in and check to see if there's a better plan or financial assistance available to them. And they should understand that if they select a plan under this SEP, this special enrollment period, that it will start the first of the month after the plan selection. So, as they can go in and browse and make plans to get a plan, once they select the plan and everything closes, if they did that in February, then 1 March, it would take effect. So it's very quick. And also, I want to encourage everyone, especially my brothers and sisters in the communities of color, to get the vaccine when it is available to them. It is free, it is safe. And then lastly, Brenda, I would be remiss if I didn't say this. It is still important for everyone to continue to wear a mask, do social distancing, wash their hands, and to help. And we talked about this before, that it takes a village. We need everyone to do this to stop the spread of this disease.
That is so true. And even after you get vaccinated, you still should do those things, because it's not the cure, but it helps you. There was something else can you just briefly say the difference between Medicaid and Medicare?
Sure. Medicare it's a insurance program designed mainly for seniors 65 and over. When people retire, they age in, we say, to Medicare, and they would sign up for Medicare Part B when they retire. If they have insurance, say with the state or whatever, and they continue that in retirement, then they just need to make sure that they keep track of that. But there are other people on Medicare as well. Some people who have disabilities are on Medicare as well. Medicaid is for people with financial challenges. They can get onto Medicaid. Medicaid program is run by the state, and the state works with people to see how they can help families and individuals who fall below the poverty line and help them to get health care. And then we have the Children's Health Insurance Program, which is just what it says. It's an insurance program to help children and to protect children as well. So all of this, as I said, started in 1965, and it has gone through a lot of changes over the years from Congress, taking into consideration feedback from citizens. And I encourage people to get in and check to see what they qualify for. And if they're struggling or having problems navigating anything, to let us know. And there's a way that they can do that on the website as well.
Thank you, Darryl. And Darryl, I'd also like to say thank you for your service, because I know that you were in the military, and just thank you. We appreciate that. So
Brenda, I appreciate you, and I appreciate you saying that, and I thank you for allowing me to be on your show. And I hope you find it beneficial. And if there's any way we, CMS and myself, can support you in the future, I'm happy to do that.
Well, Darryl, thank you for that. And it was definitely a pleasure, because we went through a few hoops to get here, but we got here.
We did.
This is Brenda Charles-Edwards, host of Seniors Matter. We're here every Friday live at 12:30 Pacific Standard Time. And if you're interested in the best gift you can give yourself or your loved ones, join me for a Zoom or individual group session on end-of-life planning, 206-683-2636. Tell me where, I'll meet you there. Up next is the coronavirus special edition. Thank you to my audience for listening, and thank you, Darryl Means, for being here. I appreciate you. We'll talk soon. Live your life like it's golden.
Pulling it off the shelf. How we want the